Hi, everyone. I am Dr. Shea Tinsley, the Executive Director at Addiction Recovery Systems, located in Charlottesville, Virginia. Today, I will provide a condensed, shortened version of the presentation that we hosted, that ARS hosted on November 16th, 2024 at Union Run Baptist Church. So if you are watching and you have a family member or a friend who is battling addiction, please watch this entire video. We have some really great resources and information that you can use to support the person you love. Uh, Today, we're going to review briefly how addiction impacts the brain. We're going to look at key causes. We're going to use an evidence-based tool called the DAST to identify signs of addiction. We're going to review a script created by the U.S. Department of Health, SAMHSA, that you can use to initiate a conversation around addiction with your loved one. I'm going to provide a really brief training of how to use naloxone nasal spray in the event of an emergency to prevent opioid overdose death. And then finally, we'll review how to enroll in treatment at Addiction Recovery Systems if you have someone who could benefit from counseling or medication addiction, medication assisted treatment. So what is addiction? So the word addiction is derived from the Latin root addictus, which means that you're bound to. And in Roman times, addictus referred to someone who was enslaved as a legal consequence of debt or an obligation. But today, the American Society of Addiction Medicine defines addiction as a treatable chronic medical disease because it impacts like brain circuits, and it also involves, your genetics, and, you have to consider your environment and individual life experiences. But what's most important when you're thinking about how to define addiction, think of addiction as an intense craving to engage in a harmful behavior despite really negative consequences. So that means even if you're aware there will be, negative, severe physical, financial, social consequences, you still have that intense craving desire to engage in a certain ritual. And in this case, we're talking about drug use. So when we refer to addiction, think of it as a brain disease, instead of thinking of addiction as a moral failing. So to clarify, when we say think of addiction as a brain disease, we think of addiction as a practice that impacts the brain. So I want to talk about how briefly how drug use interferes with the way the brain processes reality. So the way that neurons send, receive, and process signals via neurotransmitters. For example, with certain drugs like stimulants, think of cocaine and meth, that increases dopamine levels, that creates the euphoria, and that reinforces drug-seeking behavior. Think of depressants, right, like alcohol and benzos, that enhances the effect of GABA, which kind of slows and calms the brain. Like that's why people drink alcohol to relax. When we think of another substance like opioids, that's heroin or prescription painkillers, like this mimics endorphins, so it reduces pain, and it also produces like a sense of like well-being, that high. And cannabis, that alters, memory and mood. So when we say addiction is a brain disease, we mean these psychoactive chemicals impact the way that the brain functions. And here's a really great example. There was an educational resource published by Inova Hospital Systems a few years ago, which contained a dopamine index to show people truly like how when you use a substance, it triggers like a release of dopamine. So it just floods the brain. And the brain really can't distinguish between this artificial flooding that's triggered by drug use and the natural flood of dopamine that happens when you're eating a cheeseburger, right? And so normally with healthy practices, the brain will release dopamine so that you know, okay, this is a good thing and I should do it again, right? With when you eat a great meal, right, the natural amount of dopamine releases around a 1.5, measures at a 1.5. When you use a cigarette, when you smoke a cigarette, the amount of dopamine released increases to 2. When you use cocaine, the amount of dopamine release is 4. And when you use meth, the amount of dopamine that floods the brain measures at 11 points. That's a 633% increase in the amount of dopamine. So when I say, drugs will flood the brain with dopamine artificially, this is what we're talking about. It will far outweigh the amount of dopamine that you would get from a natural, normal, healthy, typical milestone. So what this means is if you're wondering, like, how can my loved one choose drugs over, a graduation or being a really great parent or, having healthy relationships? Drug use hijacks the brain's reward system by flooding it with dopamine. So the tragedy of that is once you're on drugs, the brain is telling you drugs is more fun than, your first kiss. Doing drugs is more fun than being a parent. Doing drugs is more fun than, working hard to graduate. The brain doesn't know that the high it's getting from the drug isn't real. And so the brain is telling your loved one, go for the drug. So even if they're internally, they're torn because they're thinking, I know that I should be here for my family and their commitment. I want to give this up, but the brain is pulling them in that opposite direction. So this means that the brain registers the drug use as more enjoyable than any other kind of natural occurrence. This is the reason we call it a brain disease, because of the structural changes that occur. So this is just a regular illustration of a brain, so you can see different parts. If you scan the brain of someone with an addiction to an opioid, it will show reduced activity in the prefrontal cortex there. That's the area of the brain that's used for thinking and planning. So drugs will impair your loved one's ability to make decisions, to practice self-control, to, operate in a way that we would consider normal and healthy. Drug use, if you look, also impacts the amygdala and the hippocampus, which are major components of the limbic system. And this system kind of coordinates drive, your motivation, your emotions, and impacts your memory. So with long-term use, your loved one, they're going to, in addition to not being able to think clearly and make decisions, they're going to lose their ability to kind of remember, form memories, learn. It will be very difficult for them to learn new things, to regulate their emotions. And this is true for most all substances, and that includes marijuana. So I want to note something here. There's a lot of misinformation about marijuana, that it's harmless because it's legal. And I want to let you know that if you carry a certain type of gene, marijuana can impact your brain. It will increase your chances of a psychotic episode or schizophrenia. So unless you're getting genetic testing to make sure that you don't have this gene, know that marijuana also has the same risk of changing the structure of the brain or the chemicals in your brain. Also, chronic drug use is associated with reduced brain volume. If you can remember that those old commercials with the pan and the egg, and they'll say like, "This is your brain on drugs," and they take the pan and they smash the egg. Uh, your brain will shrink, right? So your loved one with continued drug use will gradually lose their ability to think clearly, rationally, responsibly. And the tragedy is, as their brain changes, they will change, right? So gradually, your loved one will become a different person, right? With a different set of priorities, and your interactions with your loved one will not be the same. So you need to learn to adjust to this new person who is battling addiction. And this is where grief sets in for you, right? Because once you realize that the person who is currently addicted to drugs is not the same person you know and love, you have to uh, do the work to build coping skills so that you can be in an emotionally healthy space to support them in this challenging journey. So, as a loved one, so even if you do not have a history of substance use, you still need professional support to process the loss. Um, and at my clinic at Addiction Recovery Systems, I encourage every family member to to enroll in therapy with a substance use counselor. And this is how you'll learn how to navigate the difficult journey. So a trained professional can give you the coping skills and resources to get through this successfully so that you don't get involved in a codependent dynamic with uh, your loved one who's battling addiction, right? Learning how to set boundaries is a key part of kind of providing them with that support and structure that they need. So what does substance use counseling look like? Well, the substance use counseling is very similar to trauma therapy. And this is because 90% of the 23 million Americans who have reported drug addiction or substance use also report a history of trauma. So if you want to understand why your loved one is using, you also have to understand trauma and what trauma is, and the role that it plays. Called this trauma-informed therapy. So there's counseling as a licensed therapist. I believe that there is one really great clinical tool that we use to assess trauma. There are many tools, but there's one tool called the ACE. It's the Adverse Childhood Experience Assessment. And the ACE is a great predictor of quality of life outcomes, just broadly, not just for substance use, but for health and like your relationship quality. For example, if you can prevent an ACE, which is like one of the things on this list, you can reduce suicide attempts amongst high school students by as much as 89%, or prescription pain medication misuse by as much as 84%, persistent feelings of sadness and hopelessness by 66%. So what is the ACE? The ACE is a list of 10 questions that a therapist will pose to a client. And essentially, if you answer yes to 4 or more, a therapist would consider your childhood to be a traumatic childhood. So one thing on the list just means that you experience kind of the ups and downs of life, with a few exceptions, right? And for most folks, if you have one thing on this list, but a lot of protective factors, it doesn't necessarily mean that you're going to have this hard life. But for other people who answer yes to 4 or more, and they don't have any protective factors, there's a significant chance that they will fall into substance use and addiction. So the first question is about emotional abuse. Did a parent or other adult in the household often or very often swear at you, insult you, put you down, humiliate you, or act in a way that made you afraid? Here's the second childhood trauma, it has to deal with physical abuse. Did a parent or adult in the household often or very often push you, grab you, slap you, throw something at you, or ever hit you so hard that it left a mark? And we we also extend that to have you ever observed physical abuse, sexual abuse? Uh, did an adult or person at least 5 years older than you ever touch or fondle you, or have you touch their body in a sexual way, or attempt to have oral or vaginal or anal intercourse with you? The next is emotional neglect. Do you often or very often feel that no one in the family loved you or thought you were important or special, or your family didn't look out for each other, feel close to each other, or support each other? The next is around physical neglect. Do you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you, or that your parents were too drunk or high to take care of you or take you to the doctor if needed? Parental separation or divorce, were your parents ever separated or divorced? Substance abuse in the household, was there anyone in the household who was a problem drinker, alcoholic, or who used illegal drugs? The next is a mental illness in the household. Was a household member ever depressed or mentally ill? Did a household member ever attempt suicide? Domestic violence. Was your mother or stepmother often or very often pushed, grabbed, slapped, or had something thrown at her, or sometimes often or very often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit at least a few minutes, um, or threatened with a gun or knife? And finally, incarceration of a household member. Did a household member ever go to prison? And so, if you answered yes to four or more, or if your loved one who's battling addiction answers, or is eight, you could imagine, I wouldn't pose these questions to your loved one, but think about, their background and what you know of them. If they answered yes to four or more, it's likely that this trauma has led to a maladaptive coping skill, which led to trying drugs, which trying a drug, if you're in a negative environment, you don't have any protective factors, or you have the genetics, or it can lead to chronic addiction. And also, when it comes to sexual abuse, we say four or more, but when it comes to sexual abuse alone increases the likelihood that you will have a substance use issue by 4,600%. So keep that in mind as well. But there is hope. So even if you have a history of trauma, clinically speaking, you can mitigate your risk of experiencing the negative consequences of your trauma by instituting protective factors. So treatment for an addiction is protective factors, is a protective factor. Having friends and family who love you, being an active member in a church, having faith, having a sense of purpose, confidence. So if your loved one is concerned or intimidated by the idea of treatment, which is a protective factor, let them know that treatment is not what it used to be. So, in the 1930s, drug treatment was very punitive because drug use was seen as a moral failing. So, there was this is the early days of the DEA, right? And so, Ainslinger, that's the guy kind of holding the document. At the Geneva Convention, he signed the Geneva Limitation Convention in 1931, and this placed international limits on heroin, morphine, cocaine, and it also encouraged other countries to have offices to control the spread and sell of drugs. So this is the first time we see drugs kind of and drug use criminalized. And this punitive approach was reinforced during the 1970s and the 1980s. Drug use and addiction treatment focused on, again, this punitive approach, right? Saying that drug use is the result of a moral failing, drug use and addiction is a choice, right? And there was like this punitive language, like the war on drugs, right? Or just say no, which implies that addiction is somehow like a choice. Like all you have to do is say no in order to stop. But we know now, like leading scientists, advocacy organizations, state organizations like the Virginia Department of Behavioral Health and Developmental Sciences, or sorry, Services, federal department, SAMHSA, which is the Substance Abuse and Mental Health Services Administration. They emphasize the role of chemical dependency and environmental factors like trauma and genetics, family history, peer circles, and a lack of protective factors that can lead someone to substance use. So we no longer say that someone is addicted because they're a bad person or because they lack self-control. Addiction is a chronic illness, not the result of a moral failing or a personal flaw. It's a brain disease. And in fact, the rate of relapse for substance use is similar to other chronic illnesses like hypertension or diabetes. Like people with diabetes and hypertension and addiction, all of them, like other people who struggle with chronic illness, less than 50% of these folks take medication as prescribed, and less than 30% of patients comply with prescribed behavioral change. And the rate of relapse for folks who have diabetes, and hypertension is on par with folks who have a substance use disorder. It's about 40 to 60% per year. So if you wouldn't judge your loved one for having that kind of extra slice of cake at Thanksgiving or Christmas, you shouldn't judge a loved one for relapsing after getting out of a 30-day treatment program. It's just not helpful. So here, if you're wondering, all right, I've noticed some odd behaviors with my loved one, but I don't know if it's a substance use issue or if they're just going through a really hard time. Here are 10 questions that you should kind of keep in the back of your mind. Have you used drugs other than those required for medical reasons? So that means if the doctor has prescribed you something and it's like take 1 pill a day and you're taking 2, that means that you are not taking that medication for required medical reasons, or you're not taking it as prescribed. Do you use more than 1 drug at a time? So if you're smoking marijuana and also taking a prescription drug, or if you're drinking alcohol and taking a pill a day, are you always able to stop using drugs when you want to? So let's say January 1st comes around and you tell yourself, I'm going to stop drinking for the whole year, and you're unable to, or I'm going to stop taking pills, but you experience withdrawal symptoms. That's an example of, okay, not being able to stop. The next question is, have you had blackouts or flashbacks as a result of drug use? You're waking up the next morning and you don't recognize where you are or even remember how you got there. Do you ever feel bad or guilty about your drug use? Let's say that you had one too many drinks, or you smoked some marijuana, or you took a pill and you did some things to embarrass yourself. Like that's an example. Have you ever had a spouse or parent or loved one complain about your involvement with drugs? So even if you don't believe it's an issue, if someone else has, kind of pulled you aside and been like, what the heck is going on? Well, it's also a sign. Have you ever neglected your family because of your drug use? Left someone at home, or failed to attend a family event? Have you engaged in illegal activities to obtain drugs? Have you ever compromised your value system? Have you ever experienced withdrawal symptoms? Feeling sick, headache, diarrhea, nausea when you stop taking drugs? Have you had any medical problems as a result of your drug use? So the doctor tells you like, all right, you got to cut back. That's an example of a medical problem. Or memory loss, or hepatitis, HIV, convulsions. So and here's how you score it. If you answered no to like all, then you don't have a problem. But if you answered yes to one or two, that means like you have low level, like it's not an addiction, but you just need to get, you're at a place where you can kind of step back a bit. You answered yes to 3 or 5 questions. This means that you should probably talk to a therapist about these issues and consider some type of outpatient. If you answered yes to 6 or 8 questions, this means that you have a significant issue. You should consider some kind of outpatient treatment that has wraparound services, like addiction recovery systems would be a really great start. My organization in Charlottesville. If you answered yes to 9 or 10, outpatient is great, but it might also be helpful to consider a detox at a hospital, simply because there's a risk of death if you try to detox on your own. So let's say that you have gone through the DAST and you can confirm your loved one has an addiction, right? It's a yes for all of the questions that I've posed. And you want to talk to them. SAMHSA has a really great 1-page document on what to say. Here are 4 examples. I've been worried about you. Can we talk? If not, who are you comfortable talking to? I see you're going through something. How can I best support you? I care about you. I'm here to listen. Do you want to talk about what's been going on? I've noticed you haven't seemed like yourself lately. How can I help? And the great thing about this worksheet, this script that was developed by SAMHSA, is that it's encouraging you to start from a place of curiosity and humility. Most people who have an addiction will resent you if you, let's say you don't have a history of addiction and you just have like information and stats. They're going to look at you like, okay, you don't know what you're talking about. You don't know what I'm going through. And so you can't give me advice. And that is always going to be, the case. Like, you don't know. And so the best response is, I don't know. I want to learn from you. You want to build a rapport with this new person. Now, remember, you only know the person who existed before the drugs. You don't know the person that you're trying to support right now. And so my advice is to get to know them and asking questions. Don't start off by saying, you got to stop using the drugs. That is going to put them on the defense. They are going to resent you because you don't know what they're going through. I would start off the first few conversations that you have with them, learning like what's going on. When did this start? How does it feel? Like, I don't know. I've never, you don't have to say I've never used drugs. They know that. But you could say, I don't know what you're going through. How does it feel when you use? Like, where do you usually use? Like, find out details, right? That actually will get them to open up, and try not to have a reaction when they tell you, right? That also builds trust, because a big reaction will send a signal that you're judging them and they will shut down. All you want to do is learn. And then eventually, once this new person learns to trust you, they will, once they trust you, seek your advice. Once you're in that position of advice giving, instead of being direct and say, you got to stop, because telling someone with a brain disease to stop is almost an impossible request. You can pose these questions. Is what you're doing, is this working for you? Is this what you want? Right? How has this turned out for you so far? Are you satisfied with your life? Is this how you want it to work out? Like, these are really great motivational questions that you can pose to someone you love once you have established trust and they know that you're not coming from a place of judgment. So this is how to administer Narcan. Worst case scenario, you walk into your house, their house, and you see the person unresponsive, right? And you know they're unresponsive because you'll try to pinch their ear or kind of rub their chest with your knuckles. You'll try to shake them, and they're not doing anything. You want to immediately tilt the person's head back, give the person naloxone, like what we have right here. This is naloxone nasal spray, 4 milligrams it's an emergency treatment of for opioid overdose, there's a chance that, you'll see your loved one passed out and you won't know what to do or what substance they have in their system. Doesn't matter, right? You're just trying to prevent the overdose, and the medication you have will not harm them. Give it to them. So if there's something that isn't opioid based in their system, it's not going to work, but at least you tried, right? Place the nozzle into the person's nose and press down on the plunger firmly, right? When you call 911, let them know, like, my loved one's unresponsive. I don't know what's in their system, but I have administered naloxone, or I'm about to administer naloxone. Wait 2 to 3 minutes for the naloxone to take place. Like, I know on TV, like, when you're watching the shows and they give them naloxone, and it happens in like a couple of seconds, the person wakes up, but you don't know how much they've had in their system. When they wake up, they're going to be upset because they paid money for this high, and the Narcan, naloxone is kind of blocking the high feeling that they're searching for. And if they wake up and they're like, "You've ruined my high," they're going to wake up swinging. "You've ruined my high. I'm going to go use some more," because they will not feel high. And so they'll say, "Okay, well, the first reaction is, well, I have to use more then." If they use more, they will die, and let them know that. Wait for, and once the EMR medical professionals arrive, yes, they have the consent to treatment. You want them to go to the hospital. They might not see the value in it. Let them know after an hour and a half, this Narcan, naloxone will wear off, and you could go back into your kind of vegetative state, right? You're still at risk. So please go with the medical professionals, right? Of course, it's their choice, but warn them, like, refusing medical care could lead to death, and you just want them to, get additional help. If you have any questions about that, just feel free to reach out to me. So if you or a family member would benefit from treatment, that could be at our clinic. If you want to stop using drugs, but you do not want to experience withdrawal symptoms, we have a medication called methadone that will help you kind of in that recovery journey, so that you won't experience the vomiting, the diarrhea, because I know a lot of people don't want to enter recovery because they don't want to go through that detox period. So we're here to help you, right? We can provide you with the methadone. If you want to talk to someone, we also have here at Addiction Recovery Systems in Charlottesville, Virginia, we have counselors who are trained to provide you with emotional support. We do provide same-day intakes on many occasions, so you can start your journey today. You can just go to arshealth.com, reach out to us to schedule an intake, same day or next day in most cases. And please share this link with someone. I'm really grateful that you have taken time to learn more about how to support your loved one. And if you have any questions, please follow up. Thanks again.